This procedure video will take you through the techniques of placing a nasogastric tube. Though this may seem a relatively straightforward procedure, in an OSCE examination it is important to stick to a generic template when approaching this station. This should explain a formal introduction, a good and clear explanation of the procedure, and the obtaining of verbal consent. As in all procedures, universal precautions are essential. This would include hand washing and donning of gowns, gloves and goggles. Take a moment now to familiarise yourself with the equipment seen above and to think about the indications for placing a nasogastric tube.
This is a demonstration of NG tube insertion. Ideally, we want NG tube to be kept in the fridge or freezer for a while so that it's quite stiff, so that it can pass easily. I'm going to measure the NG tube length from the tip of the nose, the tragus, all the way down to the midway between xivisternum and the umbilicus. So make a marking on there, and that's how much the length the tube should be going into the stomach. After we made the measurement, lubricate the 5 to 6 centimeters, the distal end of the NG tube, with Equigel. You can choose either nostril. Run along the floor of the nostril, parallel, posteriorly. Now once the NG tube reaches the pharynx, the patient will start having the cough or the gag reflexes. You might offer the patient a glass of water to swallow. That helps us to insert the NG tube into the esophagus rather than into the trachea. So as you can demonstrate on this mannequin here, so once it reaches the pharynx, the epiglottis, which is the movable part of the mannequin, if the patient swallows, it closes the opening of the trachea, and then it aids as help the NG tube into the esophagus. So the patient keeps swallowing, the glottis keeps moving. If the patient coughs, you got to take the NG tube out. That means it's probably in the airway. Now it's beautiful going down. So we reach the marking now. Once we reach the marking, take a 20 ml or 50 ml syringe, attach to the top end of the NG tube and aspirate, and we should get a good aspirate as one test of making sure the NG tube is in the stomach. Once you take an aspirate, you can test this liquid because it should be acidic, pH should be less than 6.0. The litmus paper should turn red, and there are markings on the litmus paper. So we inserted the NG tube, we need to secure it. There are different ways of securing. One way it's commonly used is you can use elastoplast or MFX. Cut it as in Y. So you got a Y. So the top end goes to fix to the nose. The other two ends will crisscross to fix to the NG tube, so that it holds well there. Once we're done with that, get the marking and document in the notes. Having aspirated the NG tube, you got to connect to a bag, so there's a free drainage. This is how we can measure the aspiration as output, fluid output.
Having passed the nasogastric tube, it is now good practice to perform a chest X-ray to ensure the correct positioning of this tube. You are specifically looking to see that the NG tube is below the level of the diaphragm and that the tube does not follow the path of a bronchus.